they passed the law through some very, very tortured, perfectly legal, but very tortured process that created the law as it was, which means there was no guidance, none.
We hate the Affordable Care Act. I hate the commas and semicolons that put it together. I hated it when it was an idea pushed by conservatives at the Heritage Foundation and in Massachusetts with Mitt Romney. I hated it back then, and it has not improved any, in my opinion, since then.
Complicated. ACA, complicated like we've never seen before. We truly haven't seen a law this complicated as far as implementation is concerned.
It's our hope that as the provision begins to take effect, that health plans and states can see this as an opportunity to deliver health care more cost effectively.
One is absolutely think that there's more that we can do to utilize everybody in the medical profession, and that we need to be able to allow nurses to practice at the top of their license and to be able to do, there's more things that they can and should be able to do in the healthcare delivery system.
Nurse practitioners or those providers who bill Medicare should get 100% reimbursement rather than the 85% reimbursement for Medicare. So we believe that equal work should get equal pay.
I don't really see us wanting to get involved in the payment differential between so many different practitioners in so many different settings and so many different geographic areas around the country. That'd be hard for us to do.
More and more of our laws are getting more complicated, and Congress does not have the expertise that it takes to actually make legislation work. They don't have it, not at all.
Right now, when we sit down with a hospital on physician practice, that's what they're saying oftentimes when you're saying we're going to have agreed upon metrics, but their worry is that, well, what if it's non-compliance, or what if it's because of the care they're getting in the other physician's office or the other hospital?
My concern is that with the government involvement is that the more you socialize the costs of the individual behavior, the more you give regulatory power over that behavior to others. If the fact that I eat too many Big Macs is going to drive up everyone's cost, then the government has a right to say you can't eat a Big Mac anymore.
This first couple of years, 2014 and 2015, there's a lot of uncertainty. Part of it is depending on things that are almost impossible to model. Like, who would have known that healthcare.gov would be functioning so poorly?
Part of the problem is that when people are asked who they trust as a source on this issue, people tend to say that they would trust information they got from their doctors and nurses, and they would trust information that they might get from maybe like an official government source. And very few say that they would trust information they get from the media. Something like 8% say they would trust it. But when we ask people where they've actually been hearing about it, it's overwhelmingly from the media. Very few people say that they've gotten any information from their doctors or from nurses.
Everybody loves nurses and nuns. He says if you want to get something done, ask a nurse or a nun.